Hello, everyone. My name is Praveen Kalra, and today I'll be talking about changing the climate of delivering healthcare. I'm going to talk about how climate change impacts our health, how healthcare contributes to climate change, and how can we deliver a climate smart healthcare, and therefore we can heal our patients without harming the planet. So, Lancet in 2019 published an article about climate change, and it said climate change is going to be one of the biggest global health threat of the 21st century. It's happening and it is human caused. The Intergovernmental Panel on Climate Change predicted these temperatures are going to rise, but what surprised them is the rate of rise of this temperature. It almost took a century from 1906 to 2005 to increase the temperature of the Earth by almost half a degree centigrade. Now we can accomplish that objective in just 2 decades or so. Burning of fossil fuel and animal agriculture are the two predominant causes of global warming. Since we started tracking these numbers after the Industrial Revolution, you can see that the ocean surface temperatures are increasing and so are the rising sea levels, as well as increase in temperatures. Now, carbon dioxide is the main gas which we are talking about in terms of greenhouse gas emissions. Its numbers started rising dramatically since 1970. So 75% of our global emissions have happened in the last 3 decades or so. Now, 25% of this carbon dioxide is being absorbed by the oceans, leading to its acidification. And that is what brings the variability or the weather variability, which leads to different seasons of hurricanes, flooding, and so on and so forth. Uh, Temperatures are rising, as well as the mean temperatures, as well as the variance in their temperature has also risen and shifted more towards the right side. Means we are seeing extremes of hot temperatures as compared to extremes of cold temperatures. So we are seeing like wetter wets, hotter hots, and drier dries type of temperatures in the seasons in the recent decades or so. CDC published a slide about the impact of climate change on human health. So besides rising sea levels and increase in temperatures, climate change also has impacted the quality of air. It has led to decrease in air quality, leading to increased incidence of respiratory-borne illnesses and asthma. Patients with diabetes have shown increased mortality, people who are living in these conditions, because many of these pollutants act as endocrine disruptors. It has also led to changes in vector ecology, which has led to many diseases which were not prevalent at higher altitudes. For example, mosquitoes were not even found at higher altitudes many decades ago, but now there is an increased incidence of malaria, dengue, and encephalitis even at higher altitudes or so. It has also led to increase in waterborne diseases like cholera and cryptosporidiosis because of flooding, because of water pollution, leading to malnutrition, and therefore allowing communities to shift over higher areas or higher altitude areas, leading to forced migration and civil conflicts. So the impact is multifactorial. Stanford also published an article about the impact of global warming on depression and suicide, and it has shown there's an increased incidence of suicide and depression in people living in heat conditions, and therefore it also affects the mental health of our patients as well. Medicare published data about the impact of heat on elderly mortality. So Medicare collected data from 1985 to 2006 in all these patients who are above the age of 65. And they found that for every 1 degree centigrade increase in summer temperature variability, the death rate increased by almost 2.5 to 4% in patients with diabetes, heart disease, chronic lung disease, heart failure, leading to additional 10,000 deaths per year. Now, besides its impact on different domains of health, climate change does also impact on labor productivity as well as educational outcomes. So, New York actually published a data from 1998 to 2011 about the performance of their high school students who were taking exit exams. And they found that a student who took their exams at 90 degrees Fahrenheit on an average performed worse than the same student taking the same exam at 72 degrees centigrade. In fact, the student taking an exam at 90 degrees have almost a 12% likelihood of not passing an exam, and they performed 4.5% lower in each subject category when they compared it with the same student taking the exam at 72 degrees. So overall, cumulatively, it has led to the economic losses of around $37,000 per child, or almost $1 million per classroom. So let me ask you, who are these students who are going to be impacted the most? The students who live in low socioeconomic status, who does not have access to air conditioning, they are the ones who will be impacted the most with the impact of heat on their performances and exams. Climate change has also one additional dimension on our health. And let's talk a little bit about climate change and sex. So researchers have found, and it is an interesting observational study, that generally warmer weathers bring more boys and generally fewer boys in areas where there are a lot of environmental changes. So in Japan, they actually conducted a study that 9 months after an earthquake happened, they found the male population born dropped by almost 6 to 14% or so. Another researcher in Finland actually quantified that for every 1 degree centigrade increase in the temperature, increases the ratio of male female by almost 0.06%. Think about it, in a country with millions of people. A 0.6% increase may sound minuscule, but it can lead to having more boys born in a warmer temperature climate than the girls, and that can also bring gender disparity as well. Now I'm going to switch gears, and now we'll talk a little bit about how healthcare contributes to climate change. Not only we see the impact of climate change in our daily admissions in the ER, but as healthcare professionals, we could also be contributing to some of these climate change emissions. So hospitals are the second most energy resource intensive buildings in terms of consumption of electricity. Hospitals consume around 2.7 times more electricity per square feet as compared to a similar building of a similar commercial building of similar size. Hospitals are also the third most water resource intensive buildings after hotel industry and senior daycare centers. Hospitals consume around 570 gallons of water per bed. They generate around 30 pounds of waste per patient per day as well. So hospitals can lead to more greenhouse gas emissions because of the energy they use, the emissions they release, the food they provide to their patients as well as to the visitors, the type of anesthetic gases they use, the supply chain they have in terms of use of different type of disposable devices, the pharmaceuticals they use, how their employees are commuting to work. So all these things are actually contributing to the greenhouse gas emissions. So US spends around 20% of its GDP on healthcare, and it contributes to around 8% of their greenhouse gas emissions. These greenhouse gas emissions have risen by almost 30% and now hovering around 10% or so. If you quantify it further, most of these emissions are coming from the infrastructure itself, like the use of their building, equipment procurement, as well as from pharmaceutical procurement. In terms of services, hospital services constitute around 36% of greenhouse gas emissions. Around 12% of greenhouse gas emissions are coming from physician services, and 10% of greenhouse gas emissions are coming from pharmaceutical drugs or so. If you have to look at the carbon emissions from a single large academic medical center, it could be equivalent to burning up to 119 million pounds of coal each year. If US healthcare sector is in itself a country, it would rank 13th in the world in terms of greenhouse gas emissions. Now, if we talk about the global healthcare, it is the fifth biggest, largest emitter on the planet. So if you compare these numbers, that is pretty significant. The total global healthcare carbon footprint is roughly around 4.5% of the global net emissions, almost now equating to 2 gigatons or so. Even though we are spending almost 20% of our GDP on healthcare, we are not getting significantly better outcomes in terms of life expectancy as compared to other countries or so. You'll be surprised that your zip code is a better predictor of your life expectancy than your genetic code. And a classical example I can show you is in Boston. There are two cities one Back Bay and Roxbury, they are separated by almost 2.5 miles. In one city, Back Bay, the life expectancy around 91 years, whereas the other one has life expectancy of around 58 years or so. So again, when we talk about the impact of climate change, we are talking about the quality of air we breathe, what type of socioeconomic status we have, what type of access we have to education, what type of access we have to a quality of air we are breathing. And so all these things impact your life expectancy. Now, all these regulations which we are talking about in energy industry, about having cleaner energy, reduction in our goals, every industry is trying to do their part. Some of these regulations are not strictly enforced in the healthcare industry because they are generally considered as essential services and therefore they are getting a pass. In order to deliver a climate smart healthcare, we have to look at from where these emissions are coming from. And typically emissions are divided into three categories: scope 1, scope 2, and scope 3. Scope 1 emissions are coming from the building itself. How energy is consumed, what can we do to reduce our energy consumption to provide a climate smart healthcare. Also, we have to look at what type of vehicles we are using. Are we using vehicles using fossil fuels versus renewable electricity, how much anesthetic gases we are using, and how much refrigerants are using, because this is what constitutes scope 1 emissions. They typically constitute around 17% of the hospital greenhouse gas emissions. Scope 2 emissions are coming from how this electricity is purchased or produced, whether it's coming from burning of fossil fuel or it's coming from renewable sources of energy, and it contributes to around 12% of greenhouse gas emissions. So the majority of the greenhouse gas emissions are coming from scope 3, which is basically the supply chain, almost 71% or so. And that's where it boils down to what type of food we are providing to the in the hospital. How much waste are we generating, what type of pharmaceuticals we are using, and how much is pharmaceutical waste, what type of devices we are using in terms of whether we are using a lot of disposable devices versus reusable devices, how our employee are commuting to work, because that is what's contributing to the scope 3 emissions.
So I wanted to show you some photographs. These are very common images in our operating room. This is a trash can, very common, and this is the oxygen that has been left open at the end of the case. The annual cost of oxygen consumption at Stanford is around $230,000. So if anesthesia is actually a car, and I ask you what type of anesthesia do you drive, how many of you believe you drive a Tesla type of anesthesia? Just a hand count. All right, okay, we will come back to that in a few slides. So US healthcare spends the most amount of money on healthcare. It contributes to around 1/5 of their GDP, and also they consume around 8% of the energy, and eventually leading to approximately 8% into the greenhouse gas emissions. The greenhouse gas emissions have been going up by almost 30% over the last decade, starting from 2003 up till 2013. It was hovering around 7.2% in 2003, and now is around 9.8%. The largest source of greenhouse gas emission actually comes from procurement and medical equipment. Hospital services roughly contribute to around 36%, physician services around 12%, and drug expenditure is around 10%. Now, if you also look at the ozone layer depletion, we have a steepest decline in ozone layer since 2003 to 2012. And the biggest source of ozone depletion is actually prescription drugs and medical equipment infrastructure production. But on the other hand, if you look from 2007 to 2010, there's actually a steep correction in ozone layer, and that actually coincided with economic recession. So the only good news that came out of losing jobs is somehow the planet was saved, because our ozone layer got corrected by itself. So in order to assess the impact, if US healthcare is actually a country, it would rank 13th in the rank of greenhouse gas emissions, way ahead of United Kingdom, which has around 4% of greenhouse gas emissions. We produce around 7,000 tons per day of waste. 4 billion pounds a year. And why this is important? Because around 30% of the waste comes from the operating room. 70% of this waste is considered as biohazardous, even though less than 10% of that should be actually considered as biohazardous. So that definitely means we are throwing a lot of stuff into the regulated medical waste, which is not biohazardous. In fact, the amount of waste generated in an OR in one day is more than what a family of 4 will generate in a week. And just simply reducing or converting from single-use devices to disposable devices, we can decrease the OR waste by around 65%. The average cost to dispose of this regulated medical waste is around 28 cents a pound, which is roughly around 10 times than what you need to waste for a regular waste, which is around 4 to 5 cents a pound. So ASA actually conducted a survey to evaluate the practices regarding environmental susceptibility. They sent this survey to around 5,200 members, and they basically wanted to know what type of inhalational anesthetic gases which we use, what are our views about environment sustainability, recycling, reprocessing. So out of 48,000 members, 58,200 were surveyed. There was a 42% response rate. Majority of the response came from California and New York, no surprises there. 30% of the anesthesiologists or the surveyors were not even aware of the fact that volatile anesthetic agents have an impact on climate. In fact, only 13% chose anesthetic agents based on the climatic concerns. So that was a big number for me to figure out that only 13% actually knew why we are choosing a certain type of anesthetic. And sevoflurane was the most common anesthetic used, followed that by desflurane and isoflurane. These were some of the survey questions they were asked about. Does your facility use financial incentives to encourage sustainable programs? Do they invest in reprocessing? What items actually go into the red bag or the regulated medical waste? And what do you perceive are the biggest barriers for recycling in the operating room? Only 44% of the surveyors were able to answer the question correctly, what goes into that red medical waste or regulated medical waste. And the answer was anything which is visibly dripping with blood is the correct answer. So anything, the 56% just said anything that came in contact with the patient needs to go to the regulated medical waste, and that was not the right answer. In fact, when they were asked about does the department offer any incentives to encourage sustainable programs on recycling, is there a green task force, is there a curriculum built in for medical students, or does the hospital has a mandate from the leadership to pursue these programs, majority of the respondents either said they didn't know the answer or the no. Now, the secondary intent of the survey was to compare the results of this survey with a similar survey that was done in UK and Australia. So the questions asked were, do you recycle at home? 81% of them said at ASA surveyors, yes, we do, as compared to 96%. The biggest barrier for recycling was lack of recycling facilities in England versus in America it was inadequate information on recycling. Overwhelmingly, everybody wanted to educate themselves, and obviously they wanted to educate others as well. So clearly we have lack of information and inadequate leadership on one hand, and on the other hand we have bad publicity. These are some of the articles I Googled on the internet, and this is one of the first one that shows up, that surgical anesthesia contributes to climate change. This one came in Grapevine, surgical anesthesia may act as greenhouse gases contributing to global warming, almost as bad as 1 million cars.